Hello everyone, and welcome back to the Damal Consult Career Academy. If you're preparing for a nursing assistant interview, you're in the right place. In today's video, we'll be covering some of the most common and challenging nursing assistant interview questions, and providing you with effective answers that will help you stand out. Whether you're applying for a position in a hospital, clinic, or care home, these tips and strategies will guide you in showcasing your skills and experience with confidence. So, grab a pen and paper, take notes, and let's dive in to help you land your dream nursing assistant role. Don't forget to hit that subscribe button and turn on notifications so you never miss our career-boosting content. 1. Can you tell us about yourself and your experience in care? I am passionate about providing compassionate and high-quality care to patients, and I have a strong background in healthcare support. I have worked as a healthcare assistant for 5 years, during which I gained extensive experience assisting patients with personal care, mobility, and daily living activities. In my previous role at Farron Hospital, I supported patients with varying needs, including elderly individuals, those with disabilities, and patients recovering from surgery. My responsibilities included assisting with bathing, feeding, and administering basic first aid, as well as ensuring the comfort and dignity of each patient. I pride myself on being patient, empathetic, and a good listener. I believe that these qualities, combined with my ability to work efficiently under pressure, make me well suited to a nursing assistant role. I am also familiar with maintaining proper infection control measures and following NHS guidelines to provide safe and effective care. I am excited about the opportunity to bring my skills and dedication to the NHS, where I can contribute to improving patient outcomes and being part of a supportive healthcare team. 2. Why do you want to work as a nursing assistant for the NHS? I want to work as a nursing assistant for the NHS because it aligns perfectly with my passion for providing high-quality patient care and making a difference in people's lives. The NHS is renowned for its commitment to providing exceptional healthcare services and upholding values such as compassion, respect, and teamwork, which I deeply admire and strive to embody in my work. Additionally, the NHS offers an environment where I can grow professionally through continuous learning and collaboration with skilled healthcare professionals. I'm particularly inspired by the opportunity to contribute to a team that puts patients first and ensures their dignity and well-being are prioritized. I also see this role as a chance to give back to my community and be part of an organization that has a profound impact on individuals and families across the country. Being a part of the NHS would not only allow me to use my skills and experience effectively but also provide a meaningful career where I can genuinely make a difference. 3. What do you know about the NHS and its values? The NHS, or the National Health Service, is the publicly funded healthcare system in the United Kingdom, providing comprehensive healthcare services that are free at the point of use for UK residents. It is one of the largest and most respected healthcare systems in the world, known for its commitment to delivering high-quality care to everyone, regardless of their background or financial status. The NHS is guided by 6 core values, which I believe are fundamental to providing exceptional patient care. 1. Working together for patients. This value emphasizes collaboration between professionals, patients, and families to achieve the best possible outcomes. It highlights the importance of teamwork in delivering compassionate and effective care. 2. Compassion. Demonstrating care and kindness is central to building trust and ensuring patients feel valued and respected during difficult times. 3. Respect and dignity. Treating every individual with dignity, valuing their opinions, and respecting their diversity is crucial in creating a positive environment for both patients and staff. 4. Commitment to quality of care. Striving for excellence and continuously improving services ensures that patients receive safe, effective, and high-standard care. 5. Improving lives. Everything the NHS does focuses on improving the health and well-being of individuals. helping them achieve the best possible quality of life. 6. Everyone counts. This value ensures fairness and equity, making sure that no one is left behind or excluded from access to care. I admire the NHS's dedication to these values, and I'm committed to upholding them in my work. I believe that as a nursing assistant, I have a key role in delivering care that aligns with these principles, ensuring that patients feel supported, respected, and safe in every interaction. 4. Why do you believe you're suitable for this role? I believe I am suitable for this nursing assistant role because I have a strong passion for providing compassionate care and support to patients. I have previous experience working in healthcare, where I developed essential skills such as assisting with personal care, maintaining patient hygiene, and supporting mobility. I am highly organized and adept at managing multiple tasks during busy shifts, which is crucial in a hospital setting. Additionally, I align with the NHS core values of compassion, respect, and excellence. I take pride in ensuring patient dignity and confidentiality. And I always strive to create a positive and comforting environment for those in my care. My ability to communicate effectively with patients, families, and colleagues ensures that I can work collaboratively as part of a multidisciplinary team. I am also committed to continuous learning and development, and I look forward to contributing my skills while growing further within the NHS framework. 5. What are the key responsibilities of a nursing assistant in a hospital setting? As a nursing assistant in a hospital setting, my key responsibilities involve providing direct care and support to patients while assisting the nursing staff. This includes tasks such as helping patients with personal care needs like bathing, dressing, and feeding, ensuring they feel comfortable and supported during their stay. I also play a vital role in monitoring patients' conditions by regularly checking their vital signs, such as blood pressure, temperature, and pulse, and promptly reporting any changes to the nursing team. This helps in early detection of potential health issues and ensures timely intervention. Maintaining cleanliness and hygiene is another critical responsibility, as I help in keeping patient rooms clean, ensuring proper infection control practices are followed, and assisting with bed changes. Additionally, I support the nursing staff by preparing medical equipment, transporting patients for tests or procedures, and assisting with the administration of care plans. Effective communication is also key, as I interact with patients to understand their needs, provide emotional support, and relay important information to the healthcare team. My role is centered on delivering compassionate care and ensuring patients receive the best possible experience during their hospital stay. 6. How would you handle a patient who refuses assistance? If a patient refuses assistance, I would handle the situation with empathy, patience, and professionalism. I would first try to understand why they are refusing help by calmly asking open-ended questions such as, "Is there a reason you're feeling uncomfortable?" Or, "How can I make this easier for you?" This allows the patient to express their concerns, which could range from fear, embarrassment, or a desire for independence. I would respect their autonomy while gently explaining the importance of the assistance they need, highlighting how it benefits their health and well-being. For example, I might say, "I understand you might want to manage this on your own, but I'm here to make sure you stay safe and comfortable." If the refusal persists, I would try to offer alternatives or adapt my approach to meet their preferences. For instance, if they are uncomfortable with a specific procedure, I would explore whether there's another way to provide the necessary care. If the issue remains unresolved or poses a safety risk, I would escalate the matter to a senior nurse or supervisor for further guidance, ensuring that the patient's rights and dignity are maintained throughout the process. Above all, my focus would remain on building trust, fostering open communication, and ensuring the patient feels heard and respected while delivering the best possible care. 7. How would you manage your time when caring for multiple patients? When caring for multiple patients, effective time management is crucial to ensure all patients receive the care they need. I would start by prioritizing tasks based on urgency and importance. For example, I would address any immediate medical or safety needs first, such as assisting a patient in distress or ensuring medication is administered on time. I would then organize my remaining tasks by creating a mental or written checklist to ensure no patient is overlooked. Throughout the day, I would stay flexible as unexpected situations often arise in healthcare, requiring quick adjustments to the plan. Communication is another key aspect of managing time effectively. I would work closely with the rest of the healthcare team, delegating or seeking support when necessary to ensure all patients are attended to in a timely manner. Additionally, I would maintain clear and concise documentation of my tasks as I go, which saves time and ensures accurate handovers. My focus would remain on providing high-quality care while maintaining a calm and organized approach, even during busy shifts. 8. What experience do you have with assisting patients with personal care? In my previous role as a healthcare assistant, I gained significant experience in assisting patients with personal care. This involved helping patients with activities of daily living such as bathing, dressing, grooming, and maintaining personal hygiene. I was trained to respect each patient's dignity and privacy, ensuring that all care was delivered in a compassionate, respectful, and professional manner. I also supported patients with mobility, helping them move safely from their bed to a chair or assist with walking if needed. In some cases, I helped patients who required assistance with toileting, ensuring they were comfortable and maintaining their dignity throughout. Furthermore, I am familiar with using personal care equipment, such as hoists or mobility aids, and I ensure that I follow health and safety guidelines to minimize the risk of injury. I always strive to create a positive and caring environment, ensuring that each patient feels supported and comfortable, which I believe is crucial for their well-being. Above all, I believe in providing care that goes beyond physical assistance. Being attentive to the emotional and mental needs of patients is equally important. This experience has allowed me to develop strong communication skills, empathy, and the ability to work effectively under pressure, which I believe are essential for providing excellent care. 9. How do you maintain patient dignity and confidentiality? Maintaining patient dignity and confidentiality is a critical part of being a nursing assistant. I understand that patients often feel vulnerable when receiving care, and it's essential to treat them with respect and compassion to help maintain their dignity. To ensure this, I always make sure to introduce myself properly and explain the procedures I'm going to perform so the patient feels informed and involved in their care. I make sure to address them respectfully and use their preferred name. In cases of personal care, I ensure privacy by drawing curtains or closing doors, and speaking to the patient to reassure them that they're in a safe and comfortable environment. Confidentiality is equally important, and I'm committed to protecting the personal and medical information of the patients I care for. I always make sure to discuss patient details only with authorized team members, and avoid discussing any personal information outside the workplace. When handling patient records, I ensure they are stored securely and never leave sensitive documents unattended. By following these practices, I can create an environment where patients feel respected and secure, knowing their privacy is being protected at all times. 10. Tell me about a time when you dealt with a difficult patient or family member. How did you handle it? In my previous role as a healthcare assistant, I encountered a situation where I had to deal with a very anxious and upset family member. They were concerned about the care their elderly relative was receiving after a surgery, and were not satisfied with the communication they had received from the medical team. The family member became quite emotional and started raising their voice in the corridor, which was affecting other patients and staff. I approached the family member calmly and respectfully, ensuring I gave them my full attention. I acknowledged their concerns and validated their feelings by saying something like, "I understand this is a stressful time, and I want to make sure you feel heard." I then offered to help by contacting the nurse in charge, as I knew the family member needed more information about the treatment plan. I also reassured them that their relative's care was being closely monitored and explained the next steps in their loved one's recovery process. To avoid further stress, I suggested that they could join a meeting with the medical team later in the day, so all their questions could be answered in detail. By being empathetic, listening carefully, and communicating effectively, I was able to de-escalate the situation and make the family member feel more at ease. They thanked me for my support and seemed much more relaxed after the meeting with the medical team. This experience reinforced for me the importance of staying calm, listening actively, and addressing concerns in a compassionate and professional manner. It's crucial to provide reassurance when dealing with difficult situations, whether with patients or their families. 11. Describe a situation where you noticed a patient's condition worsening. What actions did you take? In my previous role as a healthcare assistant, I was caring for an elderly patient who was recovering from surgery. One day, I noticed that the patient seemed unusually breathless and was becoming more agitated than usual. I also observed that their skin was paler and their pulse seemed faster than normal. This raised my concern, as it was not typical of their usual post-operative condition. Recognizing the signs, I immediately took the following actions. 1. Monitored vital signs. I quickly checked the patient's pulse, blood pressure, and temperature to assess whether there was any further deterioration. 2. Alerted the nurse. After observing the changes, I promptly informed the nurse in charge and provided them with a detailed report of my observations. 3. Stayed with the patient. I reassured the patient and stayed with them while waiting for the nurse and doctor to arrive. I kept the patient calm and comfortable, offering support as they felt anxious. 4. Followed protocol. I ensured that the healthcare team had all the necessary information, such as the patient's medical history and any recent changes, to make informed decisions about next steps. As a result of my quick response, the healthcare team was able to assess the situation promptly and arrange for the necessary tests. It turned out that the patient was experiencing a mild complication from the surgery, which was addressed before it worsened. From this experience, I learned the importance of being vigilant and aware of subtle changes in a patient's condition, and how effective communication and teamwork can significantly impact patient outcomes. 12. Have you ever worked as part of a multidisciplinary team? How did you contribute? Yes, I have worked as part of a multidisciplinary team in my previous roles as a healthcare assistant. In these settings, I collaborated with various healthcare professionals, including nurses, doctors, physiotherapists, occupational therapists, and social workers. Working as part of a multidisciplinary team is essential because it ensures that patients receive holistic care that addresses all aspects of their health and well-being. In my previous role, I was often responsible for providing direct care to patients while also being part of discussions during team meetings. For example, I would regularly share my observations regarding patients' conditions, noting any changes in their physical or mental health. I contributed to the team by making sure that patients were comfortable, well supported, and able to follow their care plans. I would assist with activities of daily living such as feeding, bathing, and mobility, while also taking note of any concerns or issues the patients may have, which I would relay to the nurse or doctor. Additionally, I have always maintained good communication with my colleagues, which has been key to ensuring that patient care is consistent and efficient. For instance, if a patient required a change in their medication or treatment, I made sure to communicate this with the right team member and ensure proper documentation. Working with a multidisciplinary team has taught me the importance of cooperation, active listening, and sharing relevant information to provide the best possible care for patients. I believe this collaboration enhances patient outcomes and helps create a more efficient and supportive healthcare environment. 13. What would you do if a colleague wasn't following correct hygiene protocols? If a colleague wasn't following the correct hygiene protocols, I would approach the situation with professionalism and care. First, I would ensure the environment remains safe for both patients and staff by quickly taking any necessary actions to minimize risk. For instance, if the issue involved direct patient care, I would intervene by ensuring proper hygiene practices are followed immediately. Next, I would approach my colleague in a private, non-confrontational manner, expressing my concern and reminding them of the importance of hygiene protocols for patient safety and well-being. I would ask if they needed assistance or guidance regarding the protocols to ensure they understood and followed the correct procedures. If the issue continued, or if the colleague refused to comply, I would escalate the matter to my supervisor or the nurse in charge, explaining the situation calmly and objectively. I understand the importance of maintaining a safe environment, and if necessary, I would also document the incident according to the organization's policies. Ultimately, I believe that addressing hygiene violations early is crucial, not only to protect patients but also to maintain a professional, cooperative work environment. Following correct hygiene protocols is an essential part of providing quality care and preventing the spread of infections. 14. How would you handle a situation where you're unsure about a task or procedure? When handling a situation where I am unsure about a task or procedure as a nursing assistant, I would take the following approach. First, I would remain calm and focused, recognizing that it's crucial to handle any uncertainty with a clear mind to ensure the patient's safety and well-being. I believe that asking for clarification is an important part of providing safe and effective care, so I would not hesitate to seek guidance from a senior nurse or healthcare professional who is more experienced in the procedure. Before asking for assistance, I would ensure that I have reviewed any relevant documentation, such as the patient care plan or guidelines, to see if it provides clarity on how to proceed. If I am still unsure, I would ask for specific instructions or assistance from a colleague or supervisor, making sure to follow the hospital or clinic's protocols for seeking help. Additionally, I would take the opportunity to learn from the experience by asking questions and ensuring that I understand the correct procedure for future reference. I believe in continuous learning and will always seek to improve my skills and knowledge to provide the best care possible. Ultimately, my priority would be to ensure the patient's safety, follow the right procedures, and work as part of a team to provide the highest standard of care. 15. How do you handle stressful situations in the workplace? In a nursing assistant role, handling stressful situations is an important part of the job, especially when caring for patients and working in a fast-paced environment. When faced with stressful situations, I believe it's essential to stay calm, maintain focus, and prioritize tasks. First, I make sure to assess the situation and understand the root cause of the stress. Is it a medical emergency? Are there conflicting demands on my time? Once I understand the situation, I can determine the best course of action. If there is a medical issue, I follow the established procedures and seek help from senior staff if needed. If it's a time management issue, I will prioritize the most urgent tasks and delegate non-critical duties where possible. In stressful situations, I also rely on communication, whether it's reassuring a patient or talking with colleagues. Clear communication helps to ease tension and ensures everyone is on the same page. For example, if there's a delay in responding to a patient's needs, I will communicate this to the patient and offer them reassurance. Another strategy I use is deep breathing techniques to stay calm and focused. This helps me remain composed and make clear decisions, even under pressure. I also make sure to take short breaks when possible to recharge, especially during long shifts, which helps me maintain my energy and focus throughout the day. Lastly, I try to reflect on the situation once it has passed to learn from it and improve my response in the future. Whether through team debriefs or personal reflection, identifying areas for improvement helps me handle future stressful situations more effectively. In summary, I handle stress by staying calm, organizing my tasks, communicating effectively, and seeking support when needed. This helps me provide the best care possible in any stressful situation. 16. What steps do you take to ensure infection control when working with patients? Infection control is crucial in a healthcare setting, and I take it very seriously when working with patients. There are several steps I consistently follow to ensure infection control. 1. Hand hygiene. The most important step is frequent and thorough hand washing. I wash my hands before and after each patient interaction, after handling equipment, and after using the bathroom. I also ensure that I use hand sanitizers when soap and water are not available. 2. Personal protective equipment (PPE). I always wear the necessary PPE, such as gloves, masks, aprons, and face shields. When providing care that could involve exposure to bodily fluids or contact with infectious materials, I make sure to wear PPE correctly and change it between patient interactions. 3. Cleanliness and sanitization. I clean and disinfect surfaces, patient rooms, and equipment regularly using the recommended disinfectants. I am also vigilant about cleaning any equipment that I use between patients to avoid cross-contamination. 4. Isolation protocols. If a patient is identified as having a contagious illness, I follow the isolation protocols strictly. This might involve placing the patient in a private room, using specific PPE, and ensuring that any visitors or staff entering the room are aware of the risks and take the necessary precautions. 5. Waste disposal. I ensure that all waste, especially contaminated materials like dressings, gloves, and syringes, is disposed of properly. I follow the NHS protocols for disposing of medical waste and ensure all sharps are placed in the appropriate containers. 6. Training and compliance. I stay updated with the latest infection control procedures and attend mandatory training on infection prevention. I ensure that I follow NHS guidelines for infection control and promote these practices to colleagues as well. 7. Observing and reporting. If I notice any signs of infection in patients, I report it immediately to the nurse or doctor in charge. Early detection and intervention are key to controlling the spread of infection. By following these steps, I not only ensure the safety of patients but also protect myself and my colleagues from potential infections, contributing to a safer and healthier environment for everyone involved. 17. How do you prioritize tasks during a busy shift? During a busy shift, I prioritize tasks by assessing the immediate needs of the patients, and then organizing my responsibilities based on urgency and importance. First, I focus on any life-threatening or urgent tasks, such as responding to emergency calls or assisting patients who need immediate medical attention. Ensuring patient safety and comfort always comes first. Next, I take into account the scheduled activities like assisting with meals, personal care, or medication administration, and organize them by their time-sensitive nature. If there are any ongoing assessments or tasks that can be delayed, I would communicate with my colleagues or the supervising nurse to determine if those can wait until I have completed more urgent duties. I also make use of any available resources, such as asking for help when needed, and always keep an eye on patient needs throughout the shift. For example, if a patient requires assistance with a mobility task or if there's a non-urgent request, I try to complete those tasks during less busy periods of the shift or after addressing the more urgent matters. At the end of the day, I try to maintain flexibility as things can change quickly in a healthcare environment. However, I always ensure that all patients are cared for and no one is neglected, no matter how busy the shift becomes. Time management and clear communication with my team are crucial in ensuring the best possible care is provided. 18. Can you explain the importance of effective communication in patient care? Effective communication in patient care is crucial because it ensures that all aspects of a patient's needs are understood and addressed properly. As a nursing assistant, communication is key not only in understanding the patient's condition and symptoms but also in building trust. and ensuring the patient feels heard, respected, and comfortable. Clear communication allows me to relay important information to other members of the healthcare team, ensuring continuity of care. It helps prevent mistakes, such as administering incorrect medications or missing critical details about a patient's condition. By maintaining open and compassionate communication with patients, we can alleviate their fears, provide reassurance, and ensure they fully understand their treatment plans. Furthermore, communication is important in handling sensitive situations, such as when patients experience discomfort or when a patient's family needs to be updated on their loved one's condition. In my role, I also use communication to advocate for my patients, ensuring their needs and concerns are conveyed to doctors and other healthcare providers in a timely and effective manner. In essence, effective communication leads to better outcomes, improves patient satisfaction, and enhances the overall quality of care provided. 19. What motivates you to work in a role that involves providing direct patient care? What motivates me to work in a role that involves providing direct patient care is the ability to make a meaningful difference in people's lives. I find it incredibly rewarding to support patients, whether it's helping them with their daily activities, offering emotional support, or simply providing a compassionate presence. I am driven by the opportunity to help patients feel comfortable, valued, and cared for during difficult times. Additionally, I am motivated by the chance to work alongside other healthcare professionals in a collaborative environment. Being part of a team that works together to ensure the best possible outcomes for patients is something that inspires me daily. I also enjoy the variety that comes with patient care, as each day presents new challenges and learning opportunities. Ultimately, my motivation comes from the fulfillment I get when I see patients improving, feeling better, or having their needs met in a caring and professional manner. I am passionate about contributing to the well-being of others, and I believe that working as a nursing assistant allows me to do just that. 20. How do you ensure you align your work with the NHS core values? Aligning my work with the NHS core values is something I take very seriously, as I believe these values are essential to providing the best care for patients. The NHS core values are respect and dignity, commitment to quality of care, compassion, improving lives, working together for patients, and everyone counts are integral to my approach as a nursing assistant. Here's how I ensure I align with each of these values. 1. Respect and dignity. I always treat patients with the utmost respect, recognizing their individuality and personal preferences. I ensure that their dignity is maintained in all situations, particularly during personal care tasks. This includes being mindful of their privacy and offering choices when possible. 2. Commitment to quality of care. I am committed to delivering the highest quality of care to all patients. This means paying close attention to their physical and emotional needs, staying vigilant, and ensuring that any concerns are escalated to the appropriate healthcare professionals. I take pride in my work and make sure that I follow procedures and guidelines precisely to ensure the best outcomes for patients. 3. Compassion. I demonstrate compassion in everything I do. This means not only addressing patients' physical needs but also providing emotional support and a listening ear when necessary. I understand the challenges that patients and their families face, and I try to make their experience as positive as possible by showing empathy and kindness. 4. Improving lives. I aim to make a positive impact on every patient I care for. Whether it's through assisting with mobility, offering emotional support, or helping patients achieve small milestones, I work hard to ensure that I contribute to their overall improvement. I also actively engage in my professional development, so I can enhance my skills and better support the patients I work with. 5. Working together for patients. I believe in the power of teamwork, and I ensure I collaborate effectively with my colleagues. I communicate openly and respectfully with nurses, doctors, and other healthcare professionals to ensure that we are all working together to meet the needs of the patients. I understand the importance of sharing information and supporting one another to achieve the best patient outcomes. 6. Everyone counts. I treat all patients equally, no matter their background, and I ensure they feel valued and cared for. I am committed to providing a safe and supportive environment for everyone, whether caring for vulnerable patients or those with complex needs. I approach each situation with patience and understanding, ensuring that no one is overlooked. In summary, aligning my work with the NHS core values is about living these values every day through my actions. By focusing on patient-centered care, effective teamwork, and continuous learning, I ensure that my practice reflects the best of what the NHS stands for. Do you have any questions for us? When asked, "Do you have any questions for us?" during a nursing assistant interview, it's a great opportunity for you to showcase your interest in the role and the organization. Here's a well-thought-out response with relevant questions you could ask. Thank you for the opportunity to ask questions. Yes, I do have a few. 1. What does a typical day look like for a nursing assistant in this department? I would like to understand the routine and the main challenges I might face in this role to better prepare myself. 2. How do you support the professional development of your nursing assistants? I am always looking for opportunities to grow in my career, so knowing how the NHS supports ongoing learning would be very valuable. 3. What is the team structure like? How closely do nursing assistants work with registered nurses and other healthcare professionals? I believe in the importance of effective teamwork, and I would like to know more about how collaboration happens within your team. 4. How do you handle difficult or emergency situations, and what role would I play as a nursing assistant in those situations? I want to make sure I am ready to respond appropriately in high-pressure situations, and I would appreciate any insights you can provide on that. 5. What are some of the key challenges your team is currently facing, and how can a new nursing assistant help to address them? This will allow me to better understand the current needs and how I can make an immediate impact. 6. How is feedback typically provided to staff members, and how is performance evaluated? I value constructive feedback and want to make sure I am continuously improving in my role. 7. What opportunities are available for career progression within the nursing assistant role? I am committed to long-term growth and would like to know if there are opportunities to take on more responsibilities or advance within the NHS. 8. Can you describe the organization's culture and the values that are most important here? It's important for me to work in an environment that aligns with my personal values, so I'd like to understand the culture better. Thank you so much for watching today's video on nursing assistant interview questions and answers. I hope these tips have helped you feel more prepared and confident for your upcoming interviews. Remember, being well prepared is key to making a great impression and landing the job. If you found this video helpful, please give it a thumbs up, share it with others who may benefit, and leave any questions or comments down below. Love hearing from you. Also, don't forget to subscribe to Damal Consult Career Academy for more career tips and interview advice. Best of luck with your interviews, and I'll see you in the next video.